So CARES-009 study is a randomized study testing on the perioperative use of the immune-based treatment in patients with early stage and operable HCC. It's mainly run in China. It's a multi-center study. So in brief, the patients who are suitable for surgery according to the China guidelines, i.e. those, but at a high risk of recurrence, i.e. those are stage 1B to stage 3A, the China liver cancer staging system. They also recruit patients with VP1 and VP2 vascular invasion, but excluded those patients with VP3 and VP4. The patient, of course, need to be clean from the extrahepatic diseases. So they are randomized to one arm, which is Camrelizumab and Rivoceranib for 2 cycles, and then proceed to surgery, and then afterwards receive the adjuvant Camrelizumab and Rivoceranib for 15 cycles, making the systemic therapy plan a total of 1 year. And the control arm is just surgery followed by the surveillance. So the key point, the primary endpoint is event-free survival. So the key result is that there have been significant improvement in the event-free survival with a hazard ratio around 0.6 something. And also when they look at other like pathological response rate, they also see quite a sizable number of patients achieving major pathological response or even pathological CR. And the toxicity-wise, overall, we don't see any unexpected signal, although there's still some proportion of patients developing grade 3-4 toxicity around 20% from the new perioperative treatment. So this study actually confirms the values of the perioperative treatment in patients with operable HCC. Of course, in my discussion, I did raise some point. For example, whether the population stage 1B to stage 3A, which is really the surgical candidate according to international world, perhaps we need a more refined populations like BCLC-A or some BCLC-B diseases. Another point is noted that only 19% patients could complete all 15 cycles of adjuvant therapy. This has raised the point whether we need such an intensive treatment after the surgery, especially when we know that the adjuvant immunotherapy trial for 1 whole year did not improve the outcome of the patient from other clinical trials. I would advocate perhaps we need some abbreviated course of adjuvant therapy, and also which is adapted according or adjusted according to the pathological response achieved. But anyhow, this is I would say, landmark study confirming the role of perioperative treatment. I expect this regimen will be approved by China regulatory soon. And of course, whether it can be accepted totally in the West, perhaps not at this moment, but definitely I will expect it will pave a number of the randomized study for other regimen in the operative setting in HCC.